Well, thank you very much, Kathleen, and I'm delighted to be with Tom Harkin and Maria Cantwell and our guests who are here today who can speak very personally about what all of this means. When I first heard this, I thought, well, this is just a bunch of, we're going to get together to celebrate the 6-month passage of the legislation, but it's far more than that, obviously. You just heard from the Secretary the kind of news that is occurring all across this country. And while we talk in terms of the things that were in the bill, it's important to know that real people are being affected today particularly, but over the last number of days. Just in my small state, Connecticut is a very small state. We have about 3.5, a little less than 4 million people in the state of Connecticut. But just to give you an idea of what this means in my little state, as of already, I sent out a notice that 13,000 of my seniors got a check the other day of $250. Almost 50,000 people in the next 2 months will receive a similar check, elderly in my state. 50,000 people in the state of Connecticut, additional 50,000. 9,000 of my young adults in Connecticut who will be between the ages of 18 and 26 now, extending to 26, are going to be able to be covered under their family policies. May not sound like a lot to you, but 9,000 families now are going to breathe a little easier. One staff member of mine said the other day, who has young children, teenage children in their late teens, early 20s, that's the only thing he remembers about this bill, because it's such a relief to him to know that these children who are still dependent are going to be able to be covered under the family policies. 2.2 million people in my little state of Connecticut, as of today, on this date, the 6-month anniversary of passage of this bill, no longer have the fear that they're going to be lifetime caps, the very things that Tom Harkin talked about. As of today, that is effective this day forward. Now, for those who suggest they're going to repeal this bill, scrap this bill, you tell those 9,000 families in Connecticut that have young adults that can be covered. You tell the 50,000 people in my state who are elderly who are going to get a check back and not have to worry about that donut hole. You tell the 2.2 million people in my state that we're going to reimpose a lot of these insurance-imposed mandates that allow them to gain profits at the expense of my citizens' health care. So today is more than just a birthday or a celebration day. It's a day to remind people of what this bill means to average citizens across our country. And so for those reasons, I'm delighted to be here with my colleagues. I want to thank Harry Reid, who's not here with us today, but without whom this would never, ever have happened. I want to mention Ted Kennedy, who was the spiritually driving force for decades to see this day come. And obviously to Max Baucus, and obviously Maria's here, and Kathleen and the President, for all their hard work, the House members as well, for making this day possible. I realize it's still not popular with most Americans, unfortunately, but I will tell you it'll make a difference. It is already in the lives of most Americans, and that is what really counts to all of us here.